Okay.
Awesome. Hi, everyone, and welcome to our fifth mini series tonight, all about inflammation. So, if you are new tonight, my name is Nicola. I'm a physiotherapist, and I'm with my gorgeous friend Kate, who's a registered nutritionist in Tauranga. And we just love sharing women's health information. We are very passionate about helping other women feel great, feel their best, look their best, if that's something that comes with feeling your best and just sharing all of the information that we have. So tonight we're going to talk a little bit about inflammation. So this is something that obviously in my profession, well actually in Kate's as well, we deal with a lot. Like this is probably the primary reason why people come to me and potentially one of the main reasons why people go to Kate as well. So we will dive straight in, I guess. Hey Kate, is there anything you'd like to add?
No, I'm just thank you for that great intro, Nikki.
Okay.
I think not being a physio, there's so many questions that I love to ask you as well. And this is why these webinars are great, just sort of the sort of banter between tell me, like what happens in, with the types of people that you see in clinic,
Mm.
and maybe a lot of people viewing this, or maybe people tonight, are in the same situation or have experienced the same things. But when it comes to
Le
inflammation
scénario a été
and joint,
inspiré par des faits réels.
oh, uh, um, like I'd love to know what conditions that you see in your
Mm.
physio from an inflammatory point, and maybe just talk us through, that like acute versus
Mm.
chronic. That would be
Mhm.
really
Yeah.
interesting, I think, as a good sort of like starting point.
Yeah.
Th those differences, and then what you see.
Absolutely.
Yeah.
Yeah. I think the most important thing to think about straight away is that inflammation in the early stages is actually really good. So it's our body's natural response to healing and trying to repair anything that's injured. So whether it's a musculoskeletal injury like a rolled ankle, a strained knee, you would expect some degree of inflammation at the start. So it's our body's natural response. It is not our enemy in the early days. So we have to clarify that. It's actually a really good thing. So it is a healing mechanism, but when it lingers, that's when things can go wrong. So basically, we talk about inflammation in regards to pain. So people come to me with pain, and it is caused often by inflammation. So when your body is inflamed, your body releases certain chemicals that make the nerve endings in your body more sensitive. So we're thinking about things like prostaglandins, bradykinins, things that you might have heard these terms thrown out there, but they are chemicals that make your body sensitive. Um, as well as
So that's where
that,
it's like it's sore to touch, like you hurt your shoulder, and
yeah,
then it's sore to touch it or move it,
absolutely.
right? Yeah.
So the inflammation gets to that region that's sore. Yeah, absolutely. And so when you move it, it's sore. You touch it, it might be sore. It's a really good reaction. Um, the thing with inflammation, it can also obviously increase blood pressure or blood build up around that area. Again, part of healing, blood flow and fluid build up, and that can also add to increased pressure around that area, which can also lead to increased pain. So it's kind of like from an injury perspective, you will have an injury, it hurts, there's an influx of inflammation. That inflammation then causes lots of things to happen, and that increases your pain. And then you have more inflammation because there's pain. It's like this vicious cycle at the early stage, but it's a good cycle. Again, it's something that needs to happen. And if your body is doing that naturally, that's a really, really good thing. So we talk about acute or chronic inflammation. So acute inflammation to me is something that happens between day one and maybe 2 weeks. So your body is often swollen if you have an acute injury. There's heat, there'll be pain. It could also, with regards to illness, and I would say I'm not sick, but my body is trying to fight off something at the moment. So my throat's a little bit inflamed and my voice box is just a little bit off. So again, it's like a natural healing response. Um, in the acute stage, it's really important that for the first 72 hours that we don't take anti-inflammatories. Now, this is something that a lot of people ask me about this. There's a lot of research in the early phases of getting rid of the inflammation. For the first kind of 2 days or so, we don't want you to get rid of it. We want it to be there. Obviously, we can't prescribe anti-inflammatories anyway, that comes from a doctor. But it is really important to note that if something is acutely inflamed and swollen and red and sore, we don't want to jump on it unnecessarily in the early days. Certainly from like from 72 hours onwards, yes, it can be really effective. But again, that comes from your doctor anyway. Um, but there's other things that we can do with help with that. So that's acute. So 0 to 2 weeks, your body is trying to fight, basically. It's trying to heal itself very quickly. And then it comes to chronic inflammation. Chronic inflammation, it's anywhere between after 2 weeks. Thank you. Sorry about that. Anywhere between three 3 weeks up to gosh, as long as it's there. So if somebody came to me in the clinic and said, I've had this injury for 12 weeks, I'd say, okay, well, it obviously started off acute, but now it's chronic. So now things are changing. So you no longer have that acute inflammatory, red, hot, swollen joint or body part, but we're looking at like low level, silent inflammation, kind of that can damage tissue over time. So it's often linked to things like autoimmune conditions, rheumatoid arthritis, anything gut, and that will be what you talk about, arthritis, fatigue, depression, heart disease, anything that's long standing. From an injury perspective, we talk a little bit about a rope analogy. So if you think about inflammation, if it's lingering in your body for too long, or think about like a wet puddle. If you had a puddle and you lay a rope in the puddle, so it was in the dry, then in the puddle, then in the dry. And if that rope stayed lingering in that water, in that puddle for long periods of time, it would soon start to break down. So we think about our structures in our body like that. If they're bathed by inflammation for such a long time, then things can start to go wrong. So we call it like a wet rope analogy.
Can
Um,
can I jump in there? And sorry if you're going to
yeah.
talk about this. I'm just thinking of I work in a gym as well, and I mean I see
Mm.
people all the time, and I don't fix them. I see the nutrition, but they're always like, "Oh, I've had this shoulder injury. It's just been there for months." So
Mm.
is that what you're saying that there's just so like is that a physio point, or are you saying that's still related to other things, or just an
Yeah,
injury that it hasn't been treated properly for whatever reason?
probably.
Like what, yeah, what
Yeah,
do you,
absolutely.
okay.
They shouldn't, like, to me, somebody shouldn't have pain that's undiagnosed. So if somebody's saying, oh, I've got this niggly shoulder, I've had it for months, I would say, well, get your bottom to somebody and get it diagnosed because that pain that lingers, that's not going to just
Mhm.
disappear on its own
Okay.
until those issues are addressed. So for that particular person, it could be posture. It could be a rotator cuff pathology that might take 12 to 18 months, to heal. But until you've got that diagnosis and until you know that pain is like okay because it's part of the healing process,
Hmm.
yeah, you need to get it sorted. Like you cannot just have undiagnosed pain and think that that is normal. It needs to be seen. So doctor, physio, osteopath, chiropractor, anybody, whoever that you trust as your health professional. So yeah, great question. So yes, it could, if somebody is doing the same thing every day that hurts it, it could be a little bit acutely inflamed. But over time, that's a chronic pathology, absolutely. And it needs to be addressed before it becomes a really long-standing issue.
Mm.
Um, I always get asked about supplements. Um, People ask me about chondroitin, glucosamine, fish oil, and things like that. And the first thing I'll always say, is that, at the end of the day, there's good and bad research about everything. So in the health profession, it's really hard to have
Mm.
really solid clinical evidence because you can't replicate 100 of me and test me on different things. Like we're all different. So there is good research around things like fish oil and hemp oil. So the omega fatty acids for decreasing inflammation in your body. But again, that's not acute inflammation. This is more the long-standing stuff, good for your joints and your brain and your heart. There's pretty good moderate to strong support around turmeric. So having turmeric as a supplement, a good quality one. And of course, things like digestive enzymes and gut health probiotics, which Kate will talk about, I'm sure, a little bit more. With regard to other glucosamine, chondroitin, any other joint-based supplements with joint pain, um, my thought is always, you did. My thought is always take something as long as it's good quality and clean, take it for 3 months and then stop and reassess. And if you suddenly notice a big reaction once you've stopped, then potentially that was doing you a good favor. Um, However, again, you still need that diagnosis. Like you need to make sure that you know what you're dealing with. Um, so there is certainly evidence, there's really good evidence actually around vitamin D and magnesium as well, but that's a little bit out of my scope. So that's more Kate's jam as well. I will just briefly touch on anti-inflammatories. So they are very good, but you do need them prescribed. I take them every now and then for a rheumatoid pathology for my back, and they are wonderful. I certainly don't take them every day, but other people need to. So they are good. You must take them as directed. And cortisones. We often talk about cortisone injections. Personally, I think they're brilliant. They do have their pros and cons, as does anything in the health realm. I think if you have an acute inflammatory shoulder, sometimes getting an injection in there can do wonders with settling it down so that you can rehab. It's not a quick fix. It needs to be discussed with a professional, but they do work wonders, especially in frozen shoulders, which women get a lot. So a lot of research into the early prescription of a cortisone injection for those is quite great. They do work wonders. So I guess in my perspective, you need a diagnosis if you have pain. If it's acute, generally your physio could diagnose anything with regard to an injury. If it's something that's chronic and over time and not injury based, sometimes you might have to go to your doctor to get further investigations and a really good thorough diagnosis. And then we work our way through healing. So just briefly, because I know Kate's obviously will have a bit to say, stages of healing from a physio perspective. The first week, RICE, rest, ice, compression, elevation. That's what we focus on. Really basic stuff. From week 2 onwards, kind of 2 to 6 to 12 weeks, your body starts to rebuild and repair. So that's where, depending on your injury, we do early stretching for some pathologies. For other pathologies, we don't. So hamstring tears, for example, we start stretching week 1 because we know the research is good with that. So that second phase, week 2 onwards, we can start to strengthen and stretch. And then pretty much it varies from week 3, to be honest, up to week 12 again is when we start getting people back to activity, but it depends on the pathology. So it's a really hard one to talk about overall, but your body will heal itself naturally if it's given the right environment in 12 weeks, be that bone, muscle, cuts, whatever it is. So 12 weeks is your good time frame. If things aren't improving by 12 weeks, you need some help.
And
But
awesome,
that
such
isn't it.
great
Mm,
advice. And just one more question on that. If you were to tell people, you know, we know the evidence of well, why exercise is so important for us.
mm,
Could you give us a little tip? And often I see people, you know, haven't exercised for a while, then they join a CrossFit gym and they get injured. What would you say for some of our, mums who wanting to get back into, or just anybody wanting to get back into exercise, maybe push themselves a
definitely.
little bit, to maybe just like a couple of points to just watch out for in terms of maybe injury prevention.
Totally. Yeah, absolutely. You do need to ease in. So I'm that person who rushes back into things, and I've learned very valuable lessons over time, but it does come back to easing in. So if you haven't moved your body for a while, you might start off with walking. And then if you want to run, you might do some interval training. But again, it's really important to have some guidance. So whether it's a physio or a personal trainer, um, I would start slow and you want to build up your aerobic capacity over 6 to 12 weeks. That's a slow build up. You don't want to suddenly run 5Ks. You won't be walking the next day, but you might start walking, jogging, and you do that consistently over 6 to 12 weeks, and then you might run more consistently. So I get it's similar healing timeframes actually. 12 weeks, you're going to get a good aerobic base. You might introduce some basic strength, and then you just have to build up slowly. Like you wouldn't expect any massive changes in your body from my perspective for kind of 6 to 12 months.
And do
You
you
need to
advise
ease.
like stretching? Like so many of us are quite unflexible or always forward or
Yes.
driving, would you
Yeah.
say with
Oh, stretching
stretches?
is really important. Absolutely. If you could find like 3 or 4 key stretches every day, that would be awesome. And it is every day. To increase your mobility, you need to stretch every day. It's not just when you exercise, it's actually daily is what's going to give you
Mm,
better mobility. So every day.
amazing. Yeah, that's what I've heard.
Yeah, you'd be similar. You'd know all that stuff too.
Just checking from the expert, you do see things on reels and things that pop up. So you're just wanting to, and it does it really makes me. I mean, I know that I tend to like my neck comes forward a little bit, and when you see people, maybe in the 80s and they're quite hunched over, it really just reminds me to work on my posture and,
Yes.
keep things in line. Like
100%.
today I was doing presentations to uni students. So it was a lot of driving in,
Yeah.
yeah, there and back. And, instead of as soon as I got home, I'm just stretching everything out and stretching,
Yeah.
my hip flexors. So yeah, no, it's
Definitely. Actually, I will say two little things there. You hit the nail on the head. First thing I will say is that posture that you see in those 80-year-old women and men, it's not hereditary. So I'm going to throw that out there. A lot of people say to me, "Oh, it's in the
really.
family, it's genetic." Most of the time, it's just posture, and it could be there is obviously a generation of maybe women in their 80s and 90s now who did a lot of sewing or a lot of bent over work. So some part of things will be genetic, absolutely. But generally, posture is changeable unless you have a really bad scoliosis or something in there. Um, and one little tip, you mentioned the car. If you get up in the morning and the moment you get into your car, if you sit nice and tall, drop your chin down, and then you adjust your rear view mirror and adjust it to your morning posture. So by the end of the day, if you get back in
Yeah.
your car and you think, oh, I can't see anymore, think, hang on, I need to sit up. I don't need to adjust my mirror again. I need to just sit up tall and drop my chin down. Please don't ever do that. It's all about chin down.
Pushing
So
down.
that's a really good tip. So morning mirror.
Morning mirror. Okay, there you go. That's a good one. Have heard that. So another good tip. Oh, brilliant. Well, I'll just jump.
Take it away. Mhm.
I see you've got beautiful willow asleep in your arms there. So I see a lot of people for more your silent inflammation. Most people, well, nobody comes to see me because they've got specific joint pain. That's Nikki's thing. But a lot of times silent inflammation can manifest into conditions that we kind of don't even think about. And sometimes it's hard to diagnose because, when you're feeling foggy brain and you're feeling run down, fatigued, if you've watched the other series that I've talked about, it can be from, poor sleep and it can be, nutritional deficiencies. But, inflammation is now like even the New York Times has done a big article on silent inflammation, just causing so many issues in our body. And as Nikki said, it's all about that chronic, the healing process. It's like you've got especially when it comes to say like diet. So I'll tell you just, if we eat too much sugar, puts out and like refined foods and transaturated fats, these are like insults on the body, right? And your immune system is actually firing up this, especially when you first eat it, it can be like an acute assault on the body. But what happens if it's on a regular basis? It just kind of turns into this chronic inflammation that the body has not switched off
Parvana Bhavan.
okay, I'm done.
Your
You know, like
favorite
when
place.
Nikki said you got a scratch or something and you've got um you got that uh process of, the heat and the maybe some blood and, but a scab forms and it tells your body, okay, done. We've healed our little sore. Excellent. What happens is that often if we don't change our lifestyle habits, and a lot of inflammation can come from lifestyle, this inflammation, this immune system is just overactive, overactive, overactive. And that's when we can see like some of these autoimmune conditions, like lupus, for example, is just this constant inflammation. And even like joint pain, yeah, like it may have started off from an injury, but it's not going away. And even if you've had a diagnosis, spoken to somebody, a lot of the times if your diet's not right, if your sleep's not right, it just causes us to sort of ongoing, ongoing, and going. So it can manifest some of the symptoms that you might feel it would be, weight gain. Weight gain can also be a part of the inflammatory process and obesity. We look at, the research with a lot of people with, high BMIs or who are technically obese. A lot of time they've got high CRP markers. So your C-reactive protein, they got that inflammation. And obviously, when you even look at lipids, your cholesterol, if that is, elevated or sky high, same with your blood sugar levels. These are all little tests that you can do to see, that your inflammation is going up. And, that can lead to those little things can lead to, then your full-blown heart disease or cardiovascular disease as the end result. So inflammation can really, what I see is cognitive or mood decline, is something that I see. So yeah, if you can, and a lot of the times it's hard because, there's so many like nutritional factors that can go into it, but anxiety, poor mood, this can often, oh, and then there's the gut issues. So as Nikki said, leaky gut would be a really big one of the causes of a lot of inflammation and a lot of food sensitivities, um, and intolerances that also do lead to things like skin issues. So we know if you've got inflammatory, like dermatitis, eczema, we know that's inflammation going on there. So from a gut, and then it often, unless it's something that you're touching or environment, we can see it in, obviously hay fever and through the skin. Even, if you've got reoccurring infections, like UTIs, that's also a big one or like cold sores. If you get recurring cold sores, you know that and it's normally, people know that it's normally when your immune system's run down, right? When these come up. And weight gain can also be part of the inflammatory process as well. So lots of toxins coming in, and your body actually uses its fat cells to kind of collect these toxins and store them as well. So that's why sometimes when you lose weight, you can actually sort of open up these toxins and they recirculate. So if your liver's not doing a good job, sometimes you have these sort of big detox effects there. But from I guess, yeah, from a gut point of view, I'll start off just for time's sake. I think the two big things that I see that I could recommend people to take home with them from a mood point, well, a diet, like, so diet is huge in terms of making sure, so I'm going to keep it simple, enough antioxidants. Antioxidants are huge, even like your polyphenols, like what you get from green tea or even black tea. Having enough fruit and vegetables can be crucial because when often we get so much stress, external stress, work stress, family stress, there's a lot of stress that goes on. And if what we put in our mouth, if we add more inflammation, because that whole stress process is going to cause inflammation, right? And that's what it does. I mean, Nikki said before, stress may not necessarily be a bad thing to start with. It gets you out of danger. it helps your body be more adaptable, and you can actually become stronger with a bit of stress. But it's that chronic stress, just consistent, like you like on the little mouse wheel, that then um, we start to have a lot of problems with. And yeah, this low grade inflammation can really just put so much stress on the immune system. So one thing so coming back to our diet is really just making sure that we are trying to meet the recommended daily intake of, 2 pieces of fruit and 5 handfuls of vegetables. If you can do even, maybe if you're not even having one piece of fruit a day, maybe one piece of fruit, and so like baby steps. Okay, and just getting enough antioxidants, polyphenols, because these help reduce a lot of free radical activity that can increase that inflammation. And the other thing would be, yeah, looking after your blood sugar levels. Really, our body, we can get so inflamed by that roller coaster of the blood sugar levels. And that is such a huge one when it comes to your mood and your cognitive performance as well. And I see a lot of people who are like, oh, my energy levels are bad, or maybe it's, yeah, their mood. I used to be and I'm just feeling a little bit depressed. And one thing I always look at is like, what are the foods that they're eating, and are they doing that roller coaster of more high glycemic foods, your insulin spike, and then come down. Okay, your body does not like that roller coaster. So keeping, making sure we got enough protein. And Nikki said, inflammation, we need that repair and recovery, and we get that from a lot of our amino acids. So we want good quality protein. And if you find that, the more stressed you are, I kind of put people on a higher protein diet, because you are going to be breaking down, and obviously when we get older we lose our muscle mass as well, so we want that strength training, but we also want to make sure, I would say, try and double the protein amounts that you're having at the moment. So if 1 gram per kg of body weight, I would really put that up to, that would be your base minimum, 1 gram per kg body weight. I would try and double that if you're under a lot of stress. So 2 grams, at least 1.5 to 2 grams per kg of body weight. So, if you weigh 70 kgs, try to get at least 70 grams of protein into you, if not more. So that would be your base. Okay, so we want lots of repair and recovery. Nikki mentioned, oh, and just look at food sensitivities. If you know that eating like white bread or even some certain fruit and vegetables are just causing like gut issues, IBS, and being bloated, and having, or constipation is another big one for inflammation, right? So, uh, and there's so much on this topic, but I'm like, no, keep it short and to the topic. So sort your gut out, like see a health practitioner. Welcome to get in touch with me, but it really is, don't go your whole life. I know people literally in their 50s who've said my whole life I have suffered with constipation. And I'm like, let's not get to that point. Okay, if you even go, if constipation is a recurring issue, we want to get onto that quickly, because then your body just reabsorbs more toxins, causes more inflammation. Basically your immune system is just, it gets so tired and run down, and that's how you feel too. So say somebody who's suffering from constipation, and you're feeling all blocked up, pent up, you can literally feel that in your whole system. Okay, and then your immune system's working harder as well. So yeah, look at any food sensitivities, get that diagnosed if you've got any issues, and any food intolerances. We do need to help with the gut as well. So you probably heard of the term leaky gut. So that's been basically your gut cell junctions are leaky, and if you find that so the problem with that, and inflammation, I should just take it back a little bit. And I promise I won't get too sciencey, but the problem with that is that, because I see a lot of people who go, oh, I feel like gluten and dairy and this and that, and I'm on FODMAPs. I just feel like my whole body's like reacting to everything. A lot of time, if it is that leaky gut, you're getting food particles. It doesn't matter if it's gluten or part of an
Yeah.
apple or something like that. You're getting food particles that are now getting passed into the bloodstream, and because they're escaped the intestines into the bloodstream, and you're setting off an immune reaction. So leaky gut is definitely a first port of call to get sorted, so we don't have this consistent, as I said, yeah, reaction going on. It could be to any foods as well. So um, I guess the other, yeah, so just making sure that your sleep too. So I've done a whole presentation, we've done a one on sleep, but sleep is so important for draining also your brain, actually, just like your lymphatic system. Your brain has a whole system as well that needs to drain and clear, and that's why when you have a great night's sleep, you just feel so good in the morning. And that's because all those toxins have been drained away. And that is so important because like we're seeing a rise in Alzheimer's and dementia and all these sort of cognitive decline. And a lot of times that comes down to sleep and also blood sugars. Sugar is just so detrimental to the body.
They're calling it like type 3 diabetes now, eh?
That's
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 whole, yeah.
that's right. Yeah,
Look
yeah,
into all of that. Type 3 diabetes. Yeah, it's frightening. Yeah.
exactly.
Mm.
Yeah. So and that can cause a lot of the fatigue. So I think was there. I feel like I've jumped all over the show a little bit, but does that answer some of your questions? So, but also, just actually from a dietary point of view, so we want like all these lovely, antioxidants to come reduce. Oh, and Nikki did mention curcumin. So from turmeric, curcumin is
Mm.
very powerful. And I put a lot of people on curcumin as well, especially it's fantastic for mood.
Yeah.
So that would be something, again, always best to have maybe talk to a health practitioner before you just jump into something, because sometimes people spend a lot of money on supplements that it may not need at that stage, or take it in different stages.
Mm.
So curcumin and omega-3 fatty acids. Yes, this is definitely something. The meta-analysis on omega-3, your index and how much you have in our body is a really big determinant for our overall health and well-being, our longevity, our cognitive and mental performance. So
Yeah.
again, a good quality omega-3 supplement is actually really important because most people do not even
Mm.
meet the requirement of, you know, 3 to 4 serves of fish, oily fish a week. And Nikki, you mentioned vitamin D. Oh, that again, honestly, I could do a talk on vitamin D, how important that is. And so yeah, that would be one thing that I would, especially in winter, I would actually take a vitamin D. It's so important for your immune system.
Mm.
And we mustn't also forget things like being sedentary is actually very inflammatory for the body.
Yeah,
And
definitely.
the other thing would be toxin exposure. So sometimes like mold and well, yeah, what else would
Chemicals,
be?
eh? Household chemicals, basically.
Yeah, household care. Yep,
Mhm.
yep. This brain wipes, that sort of thing too. So yeah, just to recap, even if you've got don't have a physical ailment that you might need to go see a physio for, but you're feeling tired, run down, maybe reoccurring, as I said, thrush reoccurring,
Mhm.
yeah, the
For sure.
issues, and maybe even like hay fever sometimes. Yeah, that can all be silent inflammation that is just kind of just sending you some warning signals. So. Yeah, what I'm going to do as well, we're going to put together a little sheet as we always do and send that out to you guys too with, what we've spoken about and some of the things that you can do. And of course, you can always just get in touch with us as well if you've got any questions.
Sounds good. Thank you, Kate. That's amazing. There's so much we could talk about,
I know, I
right?
was like, I should, but yeah,
No,
yeah. If anybody's got any questions?
yeah.
No, but I
No,
think I'll
all
honor
good.
your time. I know I've gone over time a little bit, and you're always welcome to yeah, send us a question in. But yeah, thanks for tuning in, guys.
Thanks, everyone. Thanks for joining. We'll
Thank
see you next
you.
Thank
week.
you.
Mhm.
Okay.